Good evening and welcome everyone. I am your moderator for the evening, Ileana Bravo, and thank you for joining us for this first ever virtual UMiami Health Talk. The title, Hypertension, Heart Damage, and COVID-19, What You Need to Know. Tonight's UMiami Health Talk is presented by UHealth Virtual Clinics. UHealth expert providers are ready to care for you in our facilities or virtually. It's your choice. Wherever you are, we will be. We invite you to learn more about the measures we have in place to keep you safe, as well as your appointment scheduling options by visiting umiamihealth.org. Tonight, you're going to hear from three internationally known University of Miami Health System cardiology experts, Dr. Jeffrey Goldberger, Dr. Raul Matrani, and Dr. Carlos Alfonso. Each of our expert panelists will speak on different aspects of how COVID-19 impacts the heart, including the interactions of ACE inhibitors prescribed for hypertension with COVID-19 and the most advanced therapeutic approaches being developed at the University of Miami Health System to treat and to manage heart health during this pandemic. Now, during each panelist presentation, we are going to poll you, the audience, on questions relevant to the discussion, and we invite you to participate in these questions and answers because it's important for us to get your feedback for this survey. Your answers are going to be anonymous, and you're a very important addition to this conversation. The Q&A session will also take place at the end of the experts' presentations to answer any of the questions that you have submitted in advance. Now, don't worry if you didn't submit a question in advance. You still have time. You can ask the questions anonymously by using the Q&A feature at the bottom of your Zoom screen. Go ahead and locate it now. It's at the lower part of your screen, sort of a little toward the right. It says Q&A. So feel free to enter your questions as you think of them when we will prepare them to present them to the panelists to address at the end of the presentation. So let us begin by introducing our first presenter, Dr. Jeffrey Goldberger, Chief of the UHealth Cardiovascular Division and a Professor of Medicine at the University of Miami Miller School of Medicine. Dr. Goldberger is an internationally known innovator in the field of heart rhythm disorders, whose research and clinical care focuses on the problems of sudden cardiac death and atrial fibrillation. Dr. Goldberger's presentation will provide an overview of COVID-19 and UHealth Cardiology. Please, Dr. Goldberger, begin.
Thank you so much for joining us for this UMiami Health Talks. Next slide. The coronavirus has really affected all of our lives. It's affected the way we work, the way we socialize, the way we go shopping, and it certainly affected us in cardiology, both in terms of the kinds of heart problems that we're taking care of and how we take care of them, as well as how we provide that care. And you'll be hearing more about this as we go through the evening. I just wanted to let you know what our UHealth Cardiology group has been doing in response to the COVID-19 pandemic. The first thing that we really had to do was to establish protocols for patient care in the setting of COVID-19. This is a challenge. It's a challenge not only for us, but for institutions across the country. And many of our cardiologists have been involved in the national protocols in how to provide this care in the setting of COVID-19. We're going to talk a little bit about the cardiac effects of COVID-19. And as you know, this is a brand new infection, and there's a lot that we need to learn. When there's a lot to learn, the way we learn that is through research, and many of our cardiologists are involved in setting the agenda for research related to COVID-19 and the heart. And finally, and most important, I think, for all of you, is we've designed a special COVID-19 heart program. As you know, everybody's worried about the seriousness of the COVID-19 infections and all the people who are dying. There are over 100,000 people in the United States who have died from this. But there are many more people who are affected by COVID-19 who are actually going to be survivors, both of COVID-19 and having had COVID-19, or they will have had heart problems because of the issues related to COVID-19, even if they didn't have it itself. Next slide. So in terms of the cardiac research that we're doing at UHealth, I just wanted to very quickly give you a synopsis. We have investigators who are looking at the best way to figure out whether the heart is damaged from the COVID-19 infection. We know that the COVID-19 interacts with heart failure and makes things worse, and we have investigators who are looking at that. We're looking at the effects of stem cells and hypertension in COVID-19. And finally, Dr. Matrami and I are looking at the effects of COVID-19 on electrical abnormalities in the heart after recovery from infection of COVID-19. And these are some of the select few that I've mentioned here, but I think these are going to be important new areas that we need to understand to provide better care to our patients.
All right, so we have the first poll question, and I know we have quite a few people in the audience. So here it is. Do you have a pre-existing heart condition? Yes or no? Do you have a pre-existing heart condition? You can see the question on your screen. So all of you in the audience, if you would kindly respond to this, gives us good feedback and understanding of what patients are going through during this time, so our physicians and experts can respond to this. Do you have a pre-existing heart condition, yes or no? And you see, wow, almost split down the middle. 49% saying yes and 51% saying no. Dr. Goldberger.
Okay, so this is a very, very important question in the setting of COVID-19. The next slide will show us why. We know that COVID-19 is typically more severe in older people, but it's actually also very severe in people with pre-existing medical conditions. So, for example, people with diabetes, chronic lung disease, including asthma and COPD and emphysema, people with pre-existing cardiovascular disease, such as hypertension, coronary artery disease, and congestive heart failure. So this is a very, very important thing to make sure that it's obviously optimized and well taken care of, and to communicate to your doctors. Next slide. So the question to us for this evening is, how does COVID-19 affect the heart? And really there are two ways that it can affect the heart. One is active, and the way it actively impacts the heart is either by direct infection, where the virus enters the heart cells and causes infection of the heart. One of the other things that the COVID-19 infection does is it causes a lot of inflammation, and this can also affect the heart. And these are direct active impacts. But there's also passive impacts, and a lot of times we find that people have a lot of fear of coming to the hospital, even though they're having severe heart symptoms. And they might have unaddressed heart problems because of this. Normally they would come to the emergency room, but during the pandemic, they're avoiding the emergency room. Obviously, with the inability to go out freely, a lot of people are exercising much less. There's people are experiencing weight gain, and these are also negative health impacts from the COVID-19 pandemic. So what I'd like to review with you quickly here, this is a cartoon. On the bottom part of here in the blue is basically a cell, and the cell has a border, this line over here, and the virus can't just walk into the cell. The virus has to have a mechanism, a way to get into the cell. So on the left here, you see a picture of the virus, and the virus has a lot of these little balls on top of it, going all the way around the virus. And these balls basically serve as a key to enter into the cell. But just because you have a key to enter the cell, you also have to have a keyhole, a way to get into the cell. And the way that's done is there's a protein that sits on the cell called the ACE2 protein. It doesn't matter what that is, but it sits on the cell membrane, and the virus can fit right into that its key part can fit right into that keyhole, And when it does, then it can enter the cell. And that's essentially the way it enters cells. This ACE2 protein sits on cells throughout the body, certainly in the lungs, and that's where you get a lot of infection. But there's a lot of this ACE2 in the heart. Now, why is ACE2 important for the heart? So we're going to pop over to the right part of the screen here. And there are two hormones, angiotensin 1 and angiotensin 2, that the body makes. And these two hormones are involved in a lot of negative effects on the heart. So they can increase your blood pressure, for example. And these hormones are well known in this regard. And that's why we have developed medications that you'll hear more about later from Dr. Alfonso, called ACE inhibitors, things like lisinopril, or ARBs, angiotensin receptor blockers, like losartan. And these medications block the negative effects of these hormones on the heart. Well, it turns out that this ACE2, that's the keyhole for the coronavirus, actually has another purpose, and that's to protect the heart. It protects the heart from these negative hormones. It breaks them down. And when the coronavirus takes this ACE2 and brings it into the cell, it's no longer able to do that. It's no longer able to protect the heart. And that's one of the ways that we start to get heart damage. Next slide. Now, Dr. Matrani is going to go through this in much more detail than I am, but we talked about this direct infection of the heart. So the virus can get into the heart and cause infection of the cells, and the heart cells don't function well when they're infected. But there are many, many other mechanisms by which the heart is affected in the setting of coronavirus. It causes this tremendous inflammatory state. It causes risk of thrombus formation, and all these things can contribute to causing damage to the heart. Now, this comes from a table that Dr. Matrani and I put together for an article that's in review right now. And the only thing I really want to point out to you, this is based on a lot of reported studies that have come out of China and the United States. And there's an enzyme called troponin that we measure down here. Troponin is basically a heart muscle enzyme, and normally we don't find it in the blood. We only find it in the blood when there's damage to the heart. And you could see that if you look at across these studies, most of them show that 20 to 30% of patients who are infected with COVID have this troponin in the blood, showing that the heart cells are being affected by the COVID infection. So, as I mentioned earlier, we're very concerned about the effects on the heart that might appear well after somebody recovers from their COVID-19 infection. Now, we know, for example, that the incidence of atrial fibrillation is higher in patients who've had influenza than in patients who have not had influenza. We know also, for example, if you look at autopsy studies of patients who've had sudden cardiac death, if you look at the actual hearts, that many of them have evidence of prior myocarditis that we didn't even know. And myocarditis is, again, something that Dr. Matrani will talk about, and that's the infection of the heart. We also know that the virus, when it causes inflammation, it can cause inflammation in the fatty tissue that surrounds the heart. And when that fatty tissue gets inflamed, it can also contribute to coronary artery disease. So these are all effects that can occur in patients who have survived COVID-19 infection and have had some effect on their heart. So this comes from the Wall Street Journal, published on Friday. This was an op-ed piece from a physician in New York. And just so that everybody realizes that the problems I'm telling you about are not unique to us here in Miami, they're occurring everywhere in the country. And the title of the article is, "It's Deadly to Fear the Emergency Room." And what the author here says is shelter in place doesn't apply if you're having a heart attack. And it turns out, if you look across the country, there's about a 40% reduction in heart attacks in hospitals throughout the country. Now, that's not because 40% less people are having heart attacks. It just means that those people aren't coming to the hospital with their heart attacks, and they're having them at home.
And that's the perfect transition, Dr. Goldberger, for the poll question. Do you think you may have had a heart attack while staying home during the pandemic? Yes, no, or not sure. And I think it's important, while we give the audience time to respond here, that the not sure part is because heart attacks can manifest themselves with so many different symptoms, a wide, broad spectrum. So someone may not even be sure. So do you think you may have had a heart attack while staying home during the pandemic? It's yes, no, or not sure. And this is also something that's relevant to gender. Women's symptoms of heart attacks very different than men. So 93% say no, 1% yes, and not sure. You see 6%, and that's always a scary stat. Dr. Goldberger.
Yes, so thank you for those responses. So I just wanted to give you an example of somebody, a history of somebody who might have had a heart attack at home. So consider a 58-year-old man who has diabetes and hypertension, but also has reflux. And he's sitting watching television. He feels some burning in his chest. He goes and does what he usually does. He takes Tums and rests, and he falls asleep. After a few hours, he wakes up and he feels perfectly fine. So this person could very well have had just some heartburn, or could really have suffered a myocardial infarction, a heart attack, during this time period, and be perfectly fine. You have to remember that most people who have heart attacks survive. They don't, it's not obligatory if you have a heart attack at home that means that you die. So this COVID-19 heart program that we have designed is designed to really address 3 different concerns. So the first is listed here and addresses the question, is there any residual damage to your heart from a COVID-19 infection? So this is obviously relevant only to people who have suffered a coronavirus infection, but I think it's important to figure out whether there's residual damage. The second question is, did you have a serious heart issue that needs evaluation, but did not seek medical attention due to the pandemic? Now, as we said, this could be a heart attack. This could have been palpitations and atrial fibrillation. This could have been passing out, and you were just afraid to come to the emergency room to be evaluated, whereas if it weren't a pandemic, you would be brought to the emergency room. And finally, the third question here is, are you more in tune with your heart health and need more input on keeping your heart healthy? I think a lot of people in the setting of this pandemic are focusing on health issues, and this is a perfect time to focus on your heart health as well.
Thank you very much.
We are, for this COVID-19 heart program, we're available for consultations, both for telehealth consultations in our virtual clinic or for in-person consultations. And you can see the number, if you do want to have an evaluation for any of those 3 categories, is 305-2-HEART-U.
Thank you now, Dr. Goldberger. Didn't mean to jump the gun there. And important information, because I think, people need to know that they have choices, whether they feel comfortable going into clinic or do it virtually. So now it's my pleasure to introduce Dr. Raul Mitrani, a professor of medicine at the University of Miami Miller School of Medicine and director of UHealth Clinical Cardiac Electrophysiology. Dr. Mitrani will describe heart damage caused by COVID-19, known as myocarditis. Dr. Mitrani.
Thank you, everyone. Thank you all for sharing your time with us. I always believe it's to the patient's best benefit and advantage to be as educated as possible and partner with us as physicians when we take care of you. I also want to thank the UMiami Health Talks team for putting this together. Next slide. So I'll be talking about myocarditis and be focusing a little bit more on detail of how COVID-19 might affect the heart. This is not COVID-19, but this is a biopsy specimen from a patient with myocarditis. The smooth pink is really healthy muscle tissue. And the small purple dots are cells of inflammation that the body produces in response to an infection. So this patient had an infectious myocarditis, and the arrowhead without the tail is actually showing muscle cells being damaged. So myocarditis means inflammation of the heart, and we don't like the heart to get inflamed. When your leg muscles get inflamed, you can rest. The heart can't rest, it has to keep beating. So it's not a good thing. And many things can cause myocarditis. One is viral, which we'll be talking about the COVID-19, but myocarditis can come from bacterial infections. Some chemicals can cause myocarditis. Certain drugs can cause myocarditis, and certain immune disorders where the body attacks the muscle itself of the heart can cause myocarditis. Next slide.
So we come to the poll question of, have you either tested positive for or believe you've been infected with COVID-19? Yes or no? Have you either tested positive, so you've actually had the test, or you believe you've been infected with COVID-19, perhaps did not have the test, but you believe that you were ill with the virus? Yes or no? And we'll get Tony.
You know, Ileana, the number of patients tested positive is really a gross underrepresentation of the number of patients who have COVID-19.
Indeed.
So many patients early on couldn't get the test. They were just sent home.
Indeed. And I think that's why all of this is extremely relevant, because it's almost like a guessing game. Patients say, well, I felt really sick for 2 weeks. And
I get that all the time. They tell me, I think I've had the COVID-19.
Right. So there you go. 89% believe no, but an 11%, and we're not sure whether that means that they tested positive or they just thought they were infected.
But the 10% is more or less in line with what people think. Maybe 5%, depending on the region, have had confirmed COVID-19. Anyway, next slide. So this is a timeline for infection. So day 0, a patient may become exposed. And most of you know now, because the media reports it, that there are a lot of people who get infected but have no symptoms, maybe up to a third now, they believe. But for most patients who show symptoms, they'll start showing symptoms by day 7. At that point, you see that there's a lot of virus growing and shedding in the body, and the virus is attacking the cells in the body, whether it's the heart or other cells, causing damage. At the same time, the body is producing an intense immune response to try to harness the virus and get control and eliminate the toxic effects of the virus. But between these two effects, patients may get sicker, and by day 14, if they get sicker, they may require ventilation. They may end up with heart failure. But for those who recover, usually they recover by around day 21 or so. But patients who get very sick can go weeks and weeks in the hospital, and unfortunately, there's still a mortality rate. Too many patients are dying from this. I heard today they think the mortality rate is between 0.5 and 1%, but that's just too many patients. Next slide. So these are the different mechanisms where the heart can be affected, infected by the COVID-19 virus. And as I showed you in the first slide, it could be a direct viral cardiomyocyte toxicity as shown in the top middle. But if you look at the left-hand side of the slide, low blood pressure, if there's low oxygen, that can cause stress on the heart and heart damage. If patients have pre-existing heart disease or blockages, they can actually have a heart attack. Patients can have both a heart attack and COVID-19, and Dr. Alfonso will be talking about that later. On the right-hand side of the slide, we see and know that COVID-19 can cause these small blood clots. We call these microthrombi, and they can clog up the arteries of the heart, again causing damage. Just the stress of all the inflammation and of all the disease can cause myocardial injury and myocarditis. And the immune cells that are attacking the COVID virus can also, in some patients, mistakenly attack the heart muscles itself. Next slide. Ileana, you're muted.
There I am. This one does not leave a lot of doubt as to whether you think you were or not. Have you or any relative, friend, or coworker been hospitalized? Been hospitalized due to COVID-19? Yes or no? Have you or a relative, friend, coworker? In other words, it's either you or someone you know in your inner circle, which is becoming more and more common, been hospitalized due to COVID-19. We'll give people a chance because I know we have a flurry of activity and people participating and giving us, submitting questions for the Q&A section later. So on your screen, let's see, 76% say no. Now, are you surprised by that, Dr. Matrani?
Well, 24% say yes. So that's a large number. And we have almost 150 participants. And these are hospitalized. And most of the patients who get COVID-19 don't go into the hospital. They're able to stay home. I actually know one of the first patients hospitalized here at Hospital. But I know other people who've kind of just stuck it out at home and later were confirmed to have COVID. But next slide. So this is why we're giving this talk and trying to educate both physicians and the community. Because the combination of cardiovascular disease with COVID is very dangerous. In this slide, there's 4 groups of people. They really stratified it in kind of a 2-by-2 table. Either you had pre-existing heart disease or you didn't. And the second stratification was either you had COVID-19 affect the heart, where you had a myocarditis or other injury, or the COVID-19 did not affect the heart. So the group with the highest mortality, which is the top curve, were patients who had pre-existing heart disease and had evidence of COVID-19 infection in the heart. And their mortality was 70%. That's just unbelievably high and unacceptably high. And then you think the patients without pre-existing heart disease would do better, but even those patients, when they had evidence of myocarditis or other cardiac injury, their mortality was 37%. Again, that's super high for patients without pre-existing heart disease. Now, fortunately, we think the data are better now. This was a study published 2 months ago, and this field of COVID-19 has really moved at warp speed. Developments that usually take years are now happening in weeks to months. So I think that with better treatments now than we had 2-3 months ago, hopefully these figures are a lot better. But what we're focusing on, Dr. Goldberger and I, and all our colleagues at UM and UHealth Cardiology, is the survivors, because we think there are going to be a tsunami of survivors who've been infected with COVID, who may develop some type of heart disease, either subtle or overt, that will need treatment in the future. Next slide. So this is a graphic of the paper Dr. Goldberger and I wrote up. On the left-hand side, we discussed already the different ways that the heart can get injured. On the right-hand side, I want to discuss the possible sequelae from cardiac injury. So patients may have had myocarditis, they may have had a myocardial infarct, they may have had microinfarcts, they may have scar tissue in the bottom chambers called the ventricles or the top chambers called the atrium. But weeks or months later, they may be left with a cardiomyopathy. Cardiomyopathy means a diseased heart muscle. It can be ischemic because their arteries were blocked, or non-ischemic. They may have what we call subclinical abnormalities. What that means is that if we test them, we'll find some evidence of heart disease, but patients are asymptomatic with the heart disease. They can have arrhythmias, disturbances of their cardiac rhythm. They can have extra beats coming from the bottom chamber called PVCs. They can have ventricular tachycardia, which is life-threatening, and that would put them at risk for sudden cardiac death. Or they may be at risk for atrial fibrillation, which is a very common rhythm disorder of the top chamber in patients in this country. Next slide. So this is one of my favorite slides. It's almost like playing Where's Waldo. Ileana, are you good at playing Where's Waldo?
I used to be, not bad. Let's see how we do on this.
So this is an electron microscopy of a patient who had a biopsy who had COVID-19 associated cardiac injury. In fact, this patient had cardiogenic shock. So what you see there is in the arrows, it actually shows the actual virus in and around the heart cells. And the Where's Waldo part is you can actually see on microscopy the little spikes that Dr. Goldberger was talking about when he showed his cartoon. Those spikes are real. And those spikes are what give it the name coronavirus. It's like a crown. So my specialty is cardiac rhythm disorders. So how does COVID-19 cause cardiac rhythm disorders? Well, anytime there's cardiac injury, whether it's from direct viral tissue invasion or indirect myocardial injury, the areas of scar inflammation can actually cause what's called a tachycardia, as you see on the bottom hand side of the slide. The inflammation can also damage the heart muscle like we discussed and can cause heart rhythm disorders. On the right-hand side of the slide, I want to talk about certain drug therapies that can cause heart rhythm disorders. And everyone's been talking about hydroxychloroquine. Now, if you are taking hydroxychloroquine because you have lupus or because you have some type of arthritis, it's generally a safe drug. No drug is 100% safe, but this is generally a safe drug. However, with patients with COVID-19, because they're taking other drugs that can affect the cardiac rhythm and because they have cardiac injury, hydroxychloroquine is potentially dangerous and can cause potentially dangerous heart rhythm. I think the jury's out whether hydroxychloroquine can or cannot ameliorate the COVID-19 infection. We'll have to wait and see some scientific studies. But patients should not go to the pharmacy and try to get hydroxychloroquine just because they heard it from someone or they think they need it to prevent the disease. Next slide. So long-term outcomes in patients with COVID-19 related cardiac injury, the answer is we don't know because it hasn't been around. But based on patients recovered from other viral myocarditis, 1/3 or more may be left with chronic heart disease, heart failure, or cardiac arrhythmias. In patients with COVID-19 related cardiac injury or myocarditis, it is unknown how many will fully recover. Will it be 1/3? Will it be more? Will it be less? And we need to find out how many will have mild or severe heart failure, heart rhythm problems, because some of these heart rhythm problems are potentially deadly. That's why Dr. Goldberger and I are setting up these post-COVID-19 clinics along with Dr. Alfonso and the rest of the cardiologists in our group. Next slide. So this is our proposal and our recommendations. Acutely, we recommend that practitioners all over measure certain enzymes in the blood when patients are in the hospital with COVID-19. And if patients have these enzymes elevated, they should know whether the patients are having an acute heart attack or not. If they're having a heart attack, then doctors like Alfonso will treat the heart attack like they treat other patients' heart attack. But if they're not having a heart attack but still have myocardial injuries such as myocarditis, on the right-hand side of the slide, on the convalescent phase, we recommend that these patients go and see a cardiologist or come to our clinic and have some simple screening tests, an EKG, echocardiogram. We might recommend a cardiac monitor for 1 day up to 4 weeks, depending on symptoms. And depending on the findings, we may do more sophisticated testing or we may treat. And hopefully the treatment will help the patients live as long a quality life as possible. I think that's it, Ileana. Next.
Thank you very much, Dr. Matrani. And I think all of us in the audience who were watching the screen of those pictures you put up could find those horrifying looking crowns by now. We've learned to identify coronavirus. Now, let me remind all of you out there in the audience that we would like you to submit questions. I see many of you already are. It's the Q&A feature at the bottom of your Zoom screen, lower bottom, and you can see it there. Now we introduce you to Dr. Carlos Alfonso, an associate professor of medicine at the University of Miami Miller School of Medicine and the director of UHealth Advanced Coronary and Chronic Total Occlusion Interventions. Dr. Alfonso's presentation will explore the risks of not seeking care during the pandemic if you suffer a heart issue at home and the role of hypertension medications on COVID-19 infections. Dr. Alfonso, welcome.
Great, thank you, Ileana, and thank you all for attending this session. It's a pleasure to be here along with Dr. Goldberger and Dr. Matrani to discuss how the coronavirus and COVID-19 affects the heart. And as Dr. Goldberger summarized earlier, there's two primary ways. There's direct ways, whether it's infection of the heart muscle causing myocarditis, as Dr. Matrani reviewed earlier, or there's indirect ways. And so the indirect ways that the virus can affect the heart. And one of those ways is by neglecting care and of cardiac conditions and not getting the proper cardiac care in patients that aren't infected with the virus. And so the collateral damage that we are fearful of, and there's some reported cases that we continue to see, is that the fear of COVID-19 leads to delays in cardiovascular diagnoses, which could be harmful and deadly of themselves. So patients that don't necessarily have COVID-19, but have other cardiac issues may be fearful to come to the hospital and delay their care. And by the time they come to care, the disease process may be more advanced. And it's so, I think this is an opportune time to remind everybody that if you had symptoms, cardiac symptoms during the COVID-19 pandemic and during the past couple months, but were afraid to come to the hospital, or you're currently having symptoms, make sure that you discuss with your physicians and make sure you get evaluated. And Dr. Goldberger put some numbers up there, which where we'd be happy to help get you to see the right person. Because I think it's important, because we understand that cardiac disease remains the #1 killer. If you look at over the past couple of months, COVID-19 jumped to the #2 killer in the US, but cardiac disease remained the #1 killer in the US over that same time period. So heart disease is deadly. Now, and we'll also discuss about medications. And the summary, the one-line summary is continue to take your heart medications. Do not stop taking your heart medications without professional advice. And we'll go through some of that data. Next slide. So what about COVID-19 and heart attacks? And we know from the past that viral infections, even influenza, even the flu, could put patients at risk of having heart attacks. So patients that have a flu virus are at about 4 to 5-fold increased risk of having a heart attack. And this is the data that we see from COVID-19. So our colleagues in New York documented about 18 cases of a heart attack in COVID-19 patients. And these are patients that were hospitalized with COVID-19 and subsequently had a heart attack. And what we see here is that the majority of these patients actually went on to die. So 75% mortality, which is stark contrast to our current data. Our interventional cardiologists, as interventional cardiologists, we've become very attuned to taking care of patients with heart attacks and or myocardial infarctions. And this is much higher, this is 10-fold higher than the risks that we currently see in our patients. Next. So we know that COVID-19 and heart attacks are possible and carry a much higher risk. And so there's some different pathways that have been developed. Next slide. And what you see is, so early in the COVID-19 pandemic, there was really concern and fear about the exposure, not only to physicians, but to nursing, to staff, and what would we be able to provide, and would we be able to provide care to our patients adequately if that were to happen. And so our team here at the University of Miami, led by Dr. Mauricio Cohen, who's the director of our cath lab, helped put together some protocols on how we would take care of our patients that present with heart attacks during the COVID-19 pandemic. And this has been published through the Society of Coronary Angiography Interventions. And we won't get into it in depth, but just to say that it's an evolving field, and we're continuing to learn how to take care of our patients. But those that need to come to the cath lab and have interventional procedures, there is safe ways to do that. During the pandemic, we would suit up in our professional, in our PPEs and our garbs to be able to provide the best level of care to our patients, and we continue to do that. All patients that are coming in for procedures are being tested beforehand to make sure that we're not bringing in patients that have active infection and putting other patients at risk. At the same time, we're taking all the precautions necessary. And so I think it's the safe if you have to have a procedure at this time, to go ahead and proceed and get your procedures done. Next slide. So this is our worry, and these are two cases that we've seen over the past couple months. One is a patient that presented late after a heart attack, and this is, likely influenced by the fear of coming to the hospital early. And so by the time he came, there was a significant myocardial injury and damage, and he needed to be put on a support device just to support the heart and be able to safely get him through the procedure and treat the acute blockage. The second patient that we see on the right waited at home while having active fevers and signs of infection for fear that this was coronavirus. And when the patient came to the hospital, it subsequently was found to have a severe infection of one of the heart valves, and ended up having to have minimally invasive heart valve surgery at the hospital. Next slide. So when we talk about the connection, the ACE connection and COVID-19, we're not talking about Ace Ventura, pet detective, who also resided here in Miami, but we're talking about the ACE inhibitors and the ACE system, as Dr. Goldberger alluded to. So the ACE inhibitor, the ACE enzyme is related to blood pressure regulation. And there's two forms of the enzyme, ACE1 and ACE2. The medication primarily works at ACE1 receptors, while the virus uses the ACE2 receptors to enter the body. And both of these receptors are associated with both positive and negative effects on the body. So we often use inhibitors of these enzymes to regulate blood pressure and to lower blood pressure in patients with hypertension, or mitigate the risks of heart failure in patients that have underlying heart failure and other conditions. And the concern is that by taking these ACE inhibitors or ARBs, we may affect the infectivity of the cells and increase the risk for coronavirus. But the ACE receptors work at a different ACE receptor, and the angiotensin receptor blockers do not have any effect. And so there's no data, human data currently, that supports risk with these class of medications in patients that are taking them. And so you could continue to take your medications safely. Next, and I think we have a...
Yes, so we have a question which is the perfect transition for the questions you're posing, Dr. Alfonso. The question to our audience is, are you currently taking an ACE inhibitor such as benazepril, captopril, or another pril, or an ARB like valsartan, losartan, or another TAN for hypertension? So the answers are yes, an ACE inhibitor, yes, an ARB or ARB, or no to both. Are you currently taking any of these medications for hypertension? And it'll be interesting to see Dr. Alfonso weigh in on that, since the group obviously is being told, the audience and the patients, that they should not stop their medication. So we will wait to see the many, many people who are weighing in, and that we're so pleased are having an interactive and productive discussion with us tonight. And I see so many questions coming in. We're going to try and get to all of them. It's almost impossible, but we'll do our best to make you a part of it. And let's see what we got there. Yes, for an ACE, there you are.
Okay.
Okay, there he's back, Dr.
Sorry, my power went out for a second there.
You froze for a moment. So yes for the ACE inhibitor, 22%. Yes for the ARB, 37%. And 41% said no to both.
All right, so interesting, about 60% of our panels, are taking on some of these medications. So this is a very pertinent question, in regards to should they or should they not continue to take their medications. And so next slide. So just to summarize some of the effects of the virus and the medications and how it relates. So we know that ACE2 receptor allows the SARS-CoV-2 virus to enter the cells, but that's not the same exact receptor that the ACE inhibitors work on, because they inhibit ACE1, not ACE2, which are entirely different enzymes. And in regards to the angiotensin II receptor blockers, while they may upregulate ACE2, the evidence is not fully consistent in many trials, and it differs based on the organ system. And there is some reports that our angiotensin receptor blockers may actually be cardioprotective in patients that contract coronavirus, and we'll go through some of that data currently. Next slide. So, and what's the detriment? So given the uncertainty, why not just stop the medications to begin with? Because we really don't know. Well, this is our concern, and this is, you know, the adverse consequences of just stopping the medications. And what we see there in black and red lines is patients that either stopped their medications or never started it to begin with. And we see that they're at higher mortality risk compared to patients that continue taking the medications or start taking medications in blue and green there. And this is for patients that have heart failure as an underlying diagnosis. So, so it's not exactly in relation to COVID-19, but for patients that have reasons to take these medications, they should not stop them because it puts them at a higher risk. Next slide. And so this is now some of the early data from China looking at patients that were on ACE and ARBs versus patients that were not on ACE or ARB medications. And what you see is that patients that were not taking those medications and had underlying hypertension actually had a 3-fold increase in risk in regards to the COVID-19. Now, this is not a randomized trial, so there, you know, it is preliminary data, but it's something that's thought-provoking. Next slide.
And that leads us to the final poll question, Dr. Alfonso, which is, have you stopped or considered stopping taking medication prescribed for hypertension? And we'll wait for the vast audience to respond yes or no to this question of, have you stopped or considered stopping taking medication prescribed for hypertension? It's interesting to see also the Q&A is really productive in that people are asking everything from whether they can be tested at the for antibodies if they were exposed but never really felt that they had coronavirus. A lot of very interesting questions that hopefully we'll be able to get to. So have you stopped or considered stopping taking medication prescribed for hypertension? 89% say no, which is wonderful, but an 11% saying yes.
Absolutely. So it's you know, it's a concern, and that's why we want to get the word out in terms of what the recommendations are, so that we all feel comfortable taking the medications, you know, and behind the data, you know, and that it's, you know, currently, you know, the best pathway to go forward. Next slide. And so to summarize, the recommendations really at this point from all the professional societies, the American College of Cardiology, the American Heart Association, Heart Failure Society of America, as well as the European Society of Cardiology, all recommend for us to continue to take our cardiac medications and blood pressure medications, because there is no blood pressure medication you know, that has been shown to increase patients' risk of having a COVID-19 infection or increase the risk of adverse consequences in the patients that contract the infection. So do not discontinue your medications. There are trials underway to further evaluate these outcomes, and we're going to actually be participating in some of these trials and randomized controlled trials here at the University of Miami in the very near future. And as part of our comprehensive hypertension program, you know, we're going to be studying this, and you know, so we do have a program for patients with high blood pressure, and so, you know, for those of you that are interested, just to be aware. Next slide. So there are also some national registries which you're going to be participating in. The American Heart Association has a COVID-19 registry to look at outcomes and really best define what the quality outcomes, how to improve our outcomes. And so along with our colleagues across the nation, we're going to be participating in these endeavors, as well as an acute MI registry to look at these events. Next slide. And so, you know, really the worry is that we've gotten through the first wave, that purple wave there, you know, which is really mortality comes from the immediate infections of the valve. But what we're dealing with is the second, third, and fourth waves of infection and the consequences, you know, the impact on resources, the impact on integrated interruption of care, and other chronic conditions that have been neglected over the past 2 to 3 months. Next slide. So we know that, there have been now various reported cases of the unintended collateral damage of the disease and the hidden toll on patients that have other chronic illnesses. And we want to make sure that we really address these illnesses fully. And as we come back online, make sure that patients feel safe to come back, be evaluated in the clinics, be evaluated in the hospitals, have the procedures that they need to provide their care. Next slide. So again, I think in summary, I wanted to mention, just continue taking your medications and follow up with your cardiologists and primary care doctors. If you have some conditions, bring them up to your physicians.
Thank you so much, Dr. Alfonso. So informative. And now this leads us to the Q&A section. And of course, all three of our experts, I want to jump in here and make sure that they address the questions from the audience. And there's one that's very interesting here that I think just came in a short while ago. And so I'm going to take out of order a bit here. But the question is it true that confirmed cases of COVID-19 has been erroneously treated because they should have been treated with anti-inflammatory and antibiotics instead of been sent home and then die from heart issues? Anybody want to?
Yeah, I think that I think the concern, is that somebody, is having a heart issue to begin with and is not coming to the hospital because they're concerned of the COVID-19, that they're infected with COVID-19. And so I think that, it's important to be evaluated and be treated, as soon as possible. We don't know what the best anti-inflammatory and antibiotic regimen are for patients that are infected with COVID-19. I think trials are underway, and it will be important going forward to best define some of these treatments. Even, there's some countries, for example, France, who are now, barring patients from using hydroxychloroquine, which we've been hearing for some while may be, the magic bullet. But I think we need trials and we need data before we make the best recommendations.
Yeah. Another question that another one of the experts can take here: are individuals with prosthetic heart valves at greater risk of additional cardiac problems due to COVID-19? Any of the gentlemen want to take that?
Dr. Alfonso, do you want to take that one too?
Yeah, I'm sorry. Can you repeat the question?
Yes. So are individuals with prosthetic heart valves at greater risk of additional cardiac problems due to COVID-19?
Yeah, well, I think that it would, having a prosthetic heart valve would be defined, as a pre-existing heart condition. So while the viral infection doesn't necessarily infect the valve per se that we know of, there's no viral entities resulting in valve infections. But I think that pre-existing heart condition would predicate a higher risk, and that patient may be at somewhat higher risk of if they were to contract the virus per se.
Okay, so here's a question that I think is on a lot of people's minds. So this anonymous participant says, my son was very sick in December but refused to be admitted to the hospital. He was sick at home for about 2 weeks. I suspect he had the coronavirus. Can he still be tested for COVID-19 antibodies? I hear this a lot anecdotally from people say, well, maybe I had it a month ago. Will my antibodies show up now?
So the
COVID types of
the antibody test for the COVID antibodies is currently available. There are a variety of different kits, and they all have different what we call sensitivities and specificities. Most of them I think are not FDA approved yet, but that testing is available. And if one can show antibodies, that does imply that there was a prior infection.
Do you know how long those antibodies remain in the system, or do we not know that?
It's a good question. We don't know how long-term, and I think that's the concern that people have raised, how much long-term protection the antibodies provide. Some of the early data looking at plasma from people who have been infected and have antibodies have shown some benefit when people are treated with it. So it does seem to be effective. But how long that's going to last is currently unknown.
And here's a question that again speaks to the heart and the concerns of patients. I've tried to be evaluated, but I'm having great difficulty in seeing a doctor due to the pandemic. Are there any options available at UHealth?
Dr. Mitrani, do you want to take that one?
Sure. I mean, here at UHealth, we've ramped up our services. I'm seeing about half the patients through the internet doing telehealth. I'm seeing about half the patients come into the office. Let me assure you all that it's really safe coming to the hospital. I feel much safer here than in Whole Foods. I mean, everyone is very obsessive about keeping everything very clean. The doctors and staff have lots of masks and shields to protect you, and all the patients are screened very carefully. So I'm sure we can give you a UHealth number at the end if you want to come here, or you can go to the facility of your choice.
I think that you speak to all of us. It's the fear of the unknown, what we don't know. You're right. It could happen at Whole Foods exposure, at Publix, anywhere, but we just don't know. And that's why I think we're living in this time. Our program has come to an end. I almost feel like we need to do a multidisciplinary town hall session to get all of this in with all of you experts, because there's so many questions. I can't thank our expert panelists enough. You were informative. You spoke to our level, never, in a condescending manner. And it's important for patients to be educated. Knowledge is power for all of us. So we at the University of Miami Health System appreciate everyone's participation. Thank you for the hundreds of people who tuned in tonight. Again, we invite you to visit umiamihealth.org. And that way you can learn more about COVID-19's heart program. You can make, like the doctors have said, a virtual or an in-person appointment with any of them. And we hope you stick around, because afterwards you're going to take a survey, we hope, so you can give us some feedback and tell us about your experience and even suggest other topics that you might be interested in. But for now, we bid you good night. We thank you all, and please do stay safe. Good night.
Liana, can I say one final word? I would like to thank you for being such a wonderful moderator, and all the people who've been working behind the scenes to make this program as successful as it is, and clearly also to my colleagues, Dr. Alfonso, Dr. Mitrani, for really a wonderful program. And really also just to remind everybody, as Dr. Mitrani says, we're here. We've designed this COVID-19 heart program to really address any issues that have come up in your mind related at this time, whether it's from infection or not infection. And the number to call if you want to see one of our cardiologists is 305-243-2788. And thank you to all the participants finally for being engaged and for being interested in this topic. We are really delighted to be able to have this conversation with you, albeit in this format due to the pandemic. Thank you.
Our new normal. Good night, everyone.
Good night.